What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering X-ray documentation. So to give you context, I'm a night shift X-ray tech, been doing it for over 4 years now at a Trauma 3 ER in the great state of Texas. So if you're curious about the documentation we do as an X-ray tech, just know you have it better than nurses. My lady is a nurse, and the documentation I see her doing could be me. So if you are debating and that's something you're curious about, we have it easier. It can literally be chest pain 2 days, short of breath, fall, MVC, gunshot wound. We're literally majority of the times copying and paste whatever the doctor's reasoning for ordering is. Depending on what the patient will say, you can, adjust accordingly. I mean, if I mainly document more when it's like, let's say they have history of something, or, the patient informs you of certain things that could, affect the diagnosis, or maybe they have if the patient has like sinus inversus, which that's a body condition where everything inside is flipped. That's something important to make sure that the radiologist knows, especially if you shoot the X-ray and they didn't have a prior. If that's something you see, I would definitely document it. Other times, most of my documentation will involve when we can't get the optimal image. Sometimes maybe the patient is being aggressive. You can't get that many pictures. Maybe you're in the trauma room and there's too many other people involved, and you're like, due to whatever, unable to get more pictures, unable to this or whatever, just to cover your butt. Just so you don't get a call from the radiologist like, hey, why didn't you do better? Or hey, where's this, where's that? And you have something to cover yourself, because at the end of the day, if you get summoned to trial, it may not be today, it may be 5 years. There's a tech here who got dragged into something 10 years away. I'm pretty sure if you shot someone 10 years from now and you're like, hey, Miguel, who is John Doe so-and-so, you did a chest x-ray on so-and-so date, I'm going to tell you, unless it was some crazy stuff that happened to this person, probably couldn't remember. You look at your notes, and that's the only saving grace to have you even try to remember or kind of protect you as far as liability. Because let's say you shot someone that was pregnant. Sometimes if you shoot them and they're shielded and you can see some of the shield on it, you'll be good. If they decide to do whatever in trial. Other times you shield them and maybe the lead doesn't show up. You just document patient was shielded, or patient stated that they weren't pregnant, or whatever stuff. All it is, protect your liability and keep you, safe like that. Other times you can document like unable to get optimal AP view, or if depending on what's going on with the patient, maybe like for a wrist, they weren't able to put it down like this, they had it like this. And you just kind of document why you shot it, or like let's say a lateral L spine, usually it's a left lateral. Sometimes for whatever reason, these patients can't turn to the left side because it hurts too bad, and you do it on the right side, right? And you just document whatever reason. Same thing with like if you shoot a chest and you shoot it right, document why you did it, and you should be pretty good from there. There's times where patients, you shoot them and maybe the bones are broken and it's pretty bad, and you're not going to get the most best picture. You just document unable to get optimal images due to pain, due to body condition, or whatever. Sometimes you can't get optimal images because this is America and you have big boy. on your table, or you're doing portable and whatever reason, and your X-ray equipment can only penetrate so much, and you're not going to get the best images. Sometimes, literally because of their size, they're unable to turn their body in certain ways to get certain views, and you just kind of document it. So I'm just letting you know. It's not always pain. It's sometimes the thickness of the adipose tissue, how dense it is. You're unable to get the proper images. At this point in my job, I've seen so many things, and I know that the daytime radiologists are way more picky than the nighttime radiologists. So especially if I work days, I try to document and try a little extra harder versus the night shift one, because our night shifts are pretty chill. Or sometimes it's not even the radiologist, it's like the emergency room doctors or whoever ordered it that'll be more picky about their orders. There's been times where like the doctor will be like, hey, why weren't able to do this? And then you'll be like, sir, I don't know if you've, because sometimes they'll order stuff and they won't assess their patient before ordering it. They'll just go later once the report got in, and you'll be like, sir, I don't know if you've seen your patient. He's very hostile. Or, sir, this is the best I could do. If you want, you can talk to him and you can see if you can calm him down. Or have you not seen your patient? Because sometimes they'll order stuff and the patient will not be in the best condition, or then you won't be able to get certain images and you'll have to change your orders or do whatever. So you always write, document. And even if for like patient care, for instance, the biggest battle we have with some of these people is that the nurse or the doctor or registration or patients maybe using the bathroom or maybe whatever they have going on, that will cause you to be late on doing your images. There's times where you checked on them on multiple times and it's been like 30 minutes to an hour, and then the doctor's like, yo, where's my images? And you're like, the nurses and whoever else has been in there. Sometimes they'll be nice and you're like, you know what, I'll go down there and tell them to get out your way. And I'm like, sir, you do that. I appreciate your services, doctor, because you really can't push them that hard because then they get mad. But the doctor can, because they're the ones who run the joint. So all this is just, to keep you safe, liability, and even for the patients, because they're able to, kind of read the little notes you put, because some patients will be like, yo, why weren't able, on the report last time it said this and that. And they're like, oh, they can read the report of the tech and why stuff got done. So, once again, liability, keep you safe, or upper management looks at it and they, to avoid any issues. Always document just in case to have it. Compared to nurses, compared to doctors, we have really chill documentation. I know in the main, you have to document a little bit more, but that's mainly like for gastrographing, or if you're documenting fluoro time or the dose or whatever they have going on over there. I know you do a little bit more because like you'll document, oh, patient was on blood thinners, patient had history of this, surgery of this, or whatever stuff going on, in the fluoroscopy main. Or sometimes Mima will give you a long rundown of when you ask them what's been going on, and you'll get like a 5 to 10 minute little thing, and at that point it's just like kind of pick what you want, because you're probably not going to remember it all. Just write the important stuff. So, yeah. As always, it's been your boy Miguel. If you enjoy the world of radiology, you can check out my channel. If you want some memes, link below. You can check out some of the shorts, but I can't post that many here. But yeah, it's been your boy Miguel. We'll see you on the next one.